Our next speaker is Dr. Carrie Byington. Dr. Byington completed her medical education and pediatric training in Texas and San Francisco. Her specialty as a physician scientist is in pediatric infectious diseases and diagnostic test development. She is the H.A. and Edna Benning Presidential Professor of Pediatrics and one of two principal investigators for the Utah Center for Clinical and Translational Science. Nationally, she serves as the chair of the American Academy of Pediatrics Committee on Infectious Diseases and works closely with the U.S. Centers for Disease Control and Prevention. As a result of these experiences, she was asked to serve as the chair of the Infectious Diseases Advisory Group for the United States Olympic Committee, USOC, to address the Zika virus epidemic in Brazil. Today, she is sharing her experiences in the battle against the Zika virus at the Olympic Games. Please welcome Dr. Carrie Byington.
Thank you so much, Diane. Oops. Thank you and good afternoon. Today, I'm here to tell you about my summer. It was most definitely not a vacation. My beloved annual garden was lost to the weeds. And in spite of what everyone thought here in Utah, I never made it to Rio. However, I did have an experience of a lifetime addressing a public health emergency of Olympic proportions. I hope that this account today will give you an idea of the joy that I feel as a clinician and as a scientist, and the gratitude that I feel to this institution that so generously supports research and the mentorship of young investigators. So, let's start at the beginning. And for me, the beginning was in the summer of 2015. That is when I first began to hear disturbing reports of a new virus in Brazil, the Zika virus, a virus that I had never heard of. But by the end of that summer, I knew that the Zika virus would be a major problem for all of the Americas, including the United States and especially the Gulf Coast states. Now, why is that? It's because of these lovely ladies, the Aedes aegypti mosquito that live throughout the Americas and including the United States Gulf Coast states. I was raised in the Gulf Coast of Texas, and I still have family and friends that live there. So the Zika virus epidemic became personal for me very quickly. It also began to dominate my professional life. As you have heard, I'm a pediatric infectious disease specialist, and I chair the American Academy of Pediatrics Committee on Infectious Diseases. In that role, I have the responsibility to develop guidance for every infectious disease, including outbreaks, for the 66,000 pediatricians in the United States. We collaborate with the Centers for Disease Control in the United States and internationally with many organizations, including the World Health Organization. The Zika virus began to dominate all of our conversations. So in October of 2015, as we were having our annual meeting of the Committee on Infectious Diseases, I invited an international infectious disease expert from Brazil to attend our meeting and to teach us about the Zika virus. We all learned a great deal that day, but I will not forget my last questions to him. I asked him on that day, what about these reports of microcephaly? Are they real? Do you think they could be related to the Zika virus? He, and really no one at that time, knew the answer. But today, because of research, we know that the infant shown in this picture has the congenital Zika virus syndrome, and the microcephaly is, in fact, due to Zika virus. On February 1st of 2016, the World Health Organization declared the Zika virus epidemic a public health emergency of international significance. The epicenter of the public health emergency was in Brazil, a country already facing massive economic and political upheavals. And of course, as fate would have it, they were scheduled to host the Olympic and Paralympic Games in August and September of 2016. The U.S. Olympic Committee was under a great deal of stress at that time, trying to answer the questions and concerns of their elite athletes, their coaches, their staff, the family members who wanted to travel to Brazil for the Games. Now, the USOC has many, many healthcare professionals that work for them and serve them, but the majority of these are specialists in sports medicine or orthopedic surgery, and they were struggling with this emerging infection. They knew they needed ID reinforcements, and in fact, were advertising for such in USA Today. As it would happen, the University of Utah was discussing with the USOC at that time whether they would enter into an agreement to be a comprehensive healthcare system for the elite athletes, something that later did occur. And so the chief medical officer, Dr. Bill Moreau, called the University of Utah and said, do you have any infectious disease physicians that we could interview to serve on this new committee that we're thinking about forming? Is there a woman who could help us? I was selected to meet with Dr. Bill Moreau, and as you heard, I was ultimately chosen to hold this national position. Now, I know everyone in infectious diseases in the United States, and I got millions of calls. How did you get this gig? And they were jealous. And I don't know if I can ever really answer how I got this position. I do know that I spoke with Bill Moreau for about 2 hours on an evening in February. We discussed the epidemic. We discussed my experience with handling other public health emergencies like Ebola. We discussed my history of working with ARUP laboratories and BioFire Diagnostics, both here in Salt Lake City, to develop new diagnostic technology. And I think he liked what he heard. He liked those answers. But I think the decisive factor for him was that I came from an Olympic city. So those of you who live here know, and we've seen it earlier today, Salt Lake City hosted the 2002 Winter Games. What you may not remember is that those games happened right after the 9/11 attacks, when the risk and fear of bioterrorism, especially from a biologic like anthrax, was very high. I actually knew what had happened behind the scenes to protect the athletes and visitors who were traveling to Salt Lake City. And I think that is the reason that on late February 2016, I was invited to be the first chair of the Infectious Disease Advisory Group for the USOC. It was an opportunity that I could not turn down. The primary role of the Infectious Disease Advisory Group was to counsel those individuals who were going to be traveling with the USOC to Brazil and to help them protect themselves from the Zika virus. As a clinician, I knew that that was a vital role, and ultimately we've ended up counseling about 1,700 individuals to try to protect them. But as a scientist, I saw an opportunity. I saw that I had, through this role, access to a group of individuals that would definitely travel, and it was an opportunity for research that was unprecedented, and we could not miss it. I knew research would be the only way that we could answer the uncertainties about the Zika virus. Who's most likely to be infected? If you get infected, how long will it stay in your body? What are the reproductive outcomes for men and women after the Zika virus? And for me as a pediatrician, the most important question, what are the long-term health consequences of infants born to those who have Zika virus infection? I knew we had to do research. I knew we could not miss this opportunity, but I had to convince the U.S. Olympic Committee. And if you recall, in late February and early March, they were under a great deal of stress. Many of the athletes were discussing in very public ways their concerns and fears about traveling, and a few of them even decided to stay home. The USOC was facing the uncertainty of an emerging infection, and I could feel the pain that they had. And one of the questions that they were asking me is, if the athletes continue to hear about the Zika virus, will they just decide to stay home? Ultimately, it was the athletes themselves that convinced the USOC that, one, they needed to hear about the Zika virus, and two, they needed to have the opportunities to participate in research. They knew they were going to Rio no matter what. They had trained for it their entire lives, and they recognized that by having an opportunity to participate in research, they would have access to specialists and to testing and things that they would not normally have that would make it a safer opportunity for them to participate in the games. Remarkably, they also recognized that they had an opportunity to help others. I talked to many participants throughout this process, and they said to me, I don't intend to have a baby after the games, so I don't think that I'm at highest risk for Zika virus infection. But if by participating your team will learn something that can help others, then I want to do it. Imagine, if you will, reflect for a minute that selfless generosity of spirit exhibited by these individuals. They showed me, as so many individuals who participate in clinical research have in the past, that those who choose to participate in research are heroes, and we owe them a debt of gratitude. So, now that the athletes had convinced the USOC that research was the way to go, I really had to step up my game. The USOC, as you can imagine, is an organization that is used to world records. They are an organization that is uncompromising in excellence. And if they were going to participate in research, they expected the same thing. I needed to make the impossible seem easy. And I needed to do it at a time of great uncertainty. That's where the University of Utah came in. And this is Alumni Weekend, and so for all of you who are alumni, and for those faculty, staff, and students here, you will appreciate that the research enterprise of the University of Utah is robust. And even more importantly than that, there is a strong will to deliver excellence. So, I was able to put together a team very quickly. You see some of them here, some are in the audience. I'd like to point out my pediatric infectious disease partner, Dr. Crow Mpofo, and from adult infectious disease, Dr. Kim Hansen. And those lovely young people in the middle are from the clinical trials office who helped us throughout this. I've also included a timeline for you just to give you an impression of the time pressure that we faced. Our first meeting with the USOC to discuss research was February 25th of 2016. We learned at that meeting that about 100 people would be traveling to Brazil to prepare for the Olympics. And we thought this would be a great opportunity for a pilot study. There was just one problem. They were leaving in 18 days. So we had a little bit of a problem. We needed a scientific protocol, and we needed IRB approval in about a week. Our team got to work. With the help of the Utah Center for Clinical and Translational Science, we hammered out a scientific protocol over the weekend. We delivered it to the University of Utah IRB on Monday. They called an emergency meeting, and 4 days later, I had IRB approval. I felt like we deserved a gold medal for that by itself. So the next step was to begin enrollment. And Dr. Mpofo flew to Colorado Springs to begin enrollment. We had spots for 100 people. But would they enroll? Would they be interested? In fact, the travelers embraced the study, and we filled the 100 spots in less than 2 days. People who could not get into the pilot study began to ask, beg, and even demand of the USOC more research opportunities. So now, with the USOC under pressure to open up the study, we felt pressure to be able to enroll more people. How would we do it? Fortunately, the National Institutes of Health released a call, the very first call for Zika virus grants around that time. Our team got busy again. We analyzed our pilot data, we revised our protocol, and most importantly, we needed to make plans to enroll 1,000 people who would come from every state in the nation. It was incredibly complex. It involved negotiation with the NIH, the CDC, and the USOC, all who had different priorities and ideas, but we turned that grant in, and on July the 1st of 2016, my birthday, we received word that the grant had been funded. So it was the 1st of July, we were going into the holiday weekend, and we knew we had the funds to support this study, but now we had to get to the travelers. Almost all of the travelers were going through something called team processing, which would happen in Houston, Texas. Team processing is a time where you get together before you go to the Olympics, you get your picture taken, you get fitted for your ring, you get to spend time with Ralph Lauren and Nike and get your beautiful uniforms done, and in 2016 you got to spend time with Team Utah, Team Zika, and learn about the study. We needed to be there by mid-July. So we made our plane reservations, we rented rooms in the George R. Brown Convention Center, we hired phlebotomists, and we essentially made a home for ourselves in Houston, Texas from July 15th to September 5th, from the first patient enrollment through the last patient enrollment. Fortunately, there was excellent Mexican food and barbecue to sustain us during that time. So, I think that you can see that, and during this time, during the time that we were in Houston, the Olympics began and then the Paralympics began. And we were watching the games, not just as national fans, but as physicians and scientists. We knew these individuals as our patients and as our research participants. We knew little things about them, like who was afraid to have blood drawn, but they participated anyway. And we knew big things about them. Who wanted to conceive a child when they came back and they were trying to protect their fertility? It made this an unforgettable research experience. And as a young medical student, I also had an unforgettable research experience with the Centers for Disease Control during one of the largest measles outbreaks in the United States. That single experience changed my life and changed my career trajectory. And I hope that the experience that these young people had from the Clinical Trials Office will also result in them doing research in the future. So here's my team. I'd like to recognize particularly Tammy Lewis and Taylor Matthey. This study could not have happened without these young people. I hope that you can see we had quite an adventure this summer, and ultimately we were able to enroll 963 individuals. That is a number that no one at NIH, CDC, or USOC thought possible, and we did it because of these young people. The Paralympics ended just about 3 weeks ago, and we are in the midst of analyzing all of the specimens that we collected, and for anyone who is positive for the Zika virus, we will continue to follow them for the next 2 years. So, ultimately, we did not make it to Rio, but we created a world-class research team. We were able to collaborate nationally and internationally to stand up a study during a public health emergency that I think will give very important results for our country and all the countries that are facing the Zika virus. And we were able to mentor young people along the way. So I feel, just like Team USA, we had an incredibly successful Games. Our success, however, will not be measured in gold medals, but hopefully in healthy babies. Thank you very much.